So one of the lesser known causes of failed IVFs, unexplained infertility, recurrent miscarriages, and it's recently been linked to PCOS and endometriosis, is something called thyroid autoantibodies. Yes, so in the very good IVF clinics, they actually test women to see if they have these antibodies. But they first of all start off by testing their thyroid hormones to see if their thyroid hormones are okay. Now, what I need you to understand is that a woman's thyroid hormones can be okay, and she can still have thyroid autoantibodies. It's very possible. So a lot of times, if a woman has done IVF and it keeps failing repeatedly, then after checking all the other possible causes, if they've not checked for this particular cause, the patient should go and screen for these antibodies, because it's very possible for you to have normal thyroid function and still have these antibodies in your body. So these they are autoantibodies. They are produced by your body. They attack thyroid tissues and they can cause some dysfunction, and they've been linked to a lot of fertility issues. They've even been linked to problems in pregnant women. So when they want to treat it, of course, there are drugs they use for treating this, but nature has given us something that can help with high levels of thyroid autoantibodies, and that is black seed oil. Please note, it has to be a very potent one, because I keep saying this, but many people don't understand, is that black seed oil, or the active compound of the black seed oil, which is thymoquinone, it is a very, very sensitive compound. There is a way you will make the black seed oil and you will destroy it. There is a way you will store it and you will destroy it. So if it's not, the black seed is not pressed properly and it is not stored properly, what happens? The thymoquinone content will do what? Will decrease until gradually it's gone, and all you will have is just black seed that is practically useless. So if you have ever experienced recurrent miscarriages and you have been to the doctor and they've done hormonal profile tests, they've done everything, and they cannot pinpoint what is wrong, it would be a good idea for you to check for these antibodies, just to be on the safe side. There are other antibodies, though. It's not just thyroid autoimmune antibodies that can cause. There are other antibodies, but it's just one of them, and it is one of the most neglected ones. And you see, for me, I've always been of the impression that there is no such thing as unexplained infertility. There has to be a reason. It's just that the person that is trying to figure out what the reason is has not put their finger on it yet. So these are some of the things that can fly under the radar, and you can see women with high levels of this antibody in their bodies, they keep suffering for years. When they go for the routine test, they'll tell them they are okay based on the routine tests, but they would usually not do this particular test for thyroid antibodies, and it will just keep flying under the radar, and the woman will keep having miscarriages or keep suffering for years. Okay, so it's important for these things to be done. And when you want to handle anything that has to do with fertility, like I was telling somebody in a member of our tribe in the DM, I said it's impossible and it doesn't make sense for anybody to come and tell you, I have fertility products, come and buy. No, the person first of all has to figure out if there is an underlying issue, and the only way the person can do it is to have you run tests. So in a typical situation, and I've had this before, these are experiences I've had with, managing women to do IVF and all that, because I help women to prepare for IVF. I help women troubleshoot if an IVF goes wrong. And I have found out that a lot of these tests, they don't do them, even in the clinics. So when these women will go have 5 IVF cycles and it fails, and the clinic doesn't investigate further to try and find out why it keeps failing. Yeah, like I said, I've had a similar case. I've handled a similar case where I had to tell the client to go and run tests for anti-nuclear antibodies, antiphospholipid antibodies. They were okay, a little bit on the high side, but okay. And now said she should do the thyroid autoantibodies, and it was over the roof. And that there was the reason why her IVF kept failing. But of course, nobody thought it was a test that should be run to figure out why. Because they had done thyroid function test, and her thyroid function test was okay. So like I normally say, you see, as a woman, God has made us to be very complicated creatures. Even our reproductive system is so complicated that it takes so much for a woman to be able to reproduce successfully, and it can just take one thing to make it impossible. So when a person wants to treat any type of infertility, you have to figure out what it is. What type of infertility is it? What is causing it? And then treat the cause. Otherwise, the woman is just wasting their money. That's why sometimes when I see all these fertility teas being run, they are running sponsored ads on fertility teas. I wonder why they do it. How do you tell what type of issue that is making the woman not to be fertile if you've not even actually sat down with her, asked her questions, asked her to run tests, review the tests, and figure out what is wrong? How? Yeah, so that's food for thought. Anyway, as far as it is autoimmune antibodies that are due to thyroid, these are thyroid autoimmune antibodies, there is a very good remedy for it, and that is the black seed oil. And not just any black seed oil, the very potent one that we make at Useful Herbs.